Hey everybody, welcome back to What's for Dinner. Remember, this is not to be considered medical advice. If you guys need any medical advice, please reach out to your highly trained and knowledgeable healthcare provider. If you're looking for someone who specializes in hormones, worldlinkmedical.com has a provider directory. If you're looking for somebody who works in metabolic health, you can go on to lowcarbusa.org or smhp.org. So, how are we doing today?
Yeah, good. Except when you say highly trained and knowledgeable. Yeah, so we're doing part 2 of bioidentical hormone replacement therapy, mainly for the ladies. We'll do the men after. Last night in the video, I was listening back and I said, when I started estrogen, 7 weeks, my hot flashes, my night sweats went away. I meant 7 days. My night sweats went away, and 6 weeks, my belly weight went back down. So I did want to clarify that. So what I want to tell you is, if you ask your provider, it doesn't matter what kind of provider it is, about hormones, they're going to tell you they're dangerous and they cause breast cancer. What you should do, well, what you could do, I don't know. Sometimes I just think they're not even worth it. But what you could do is ask them what study they're referencing. What they'll say is the study everyone knows. Like, I don't have to reference the study, everyone knows. But they're referencing the Women's Health Initiative, the WHI trial, released in 2002, a very flawed study. Only 10% of the participants in that study were age 50 to 54. The other 70% were above 60. So the mean age for that study was 63 years old. So last night I told you that I went on estrogen. I started hormones at 42, progesterone, thyroid, and testosterone. I went on estrogen on my 50th birthday. Had I waited until I was 63 years old, that would be 13 years. My coronaries have no protection of estrogen. It doesn't matter if I'm eating carnivore. Estrogen helps the elasticity of the cardiac vessels. So had I waited till I was age 63, I could have things develop that then could go knock off the necrotic cap and give you a heart attack and stroke. So the mean age was 63, which means those women had been in menopause greater than 10 years. They didn't tell you that most of them were overweight and quite a bit were actually obese. They don't tell you that half of them were smokers. They don't tell you that 10% already had high blood pressure. And they don't tell you that, did I say smokers already?
Mm-hmm.
Okay. They didn't tell you that many of them had already had heart attack and stroke. So this was not really a great study, but this is what everyone hangs their hats on. And this is what is parroted to this day in the establishment. The Women's Health Initiative studied Premarin, pregnant horse pee, so pregnant mare urine, Premarin, and Provera. It was really the Provera that caused breast cancer. They stopped that arm early. The problem is, for your GYNs and your highly trained and knowledgeable providers, is they think Provera is the same as progesterone. So the problem is, Provera is a progestin. So that's the Depo-Provera birth control shot. That's the mini birth control pill. And that is the Mirena IUD. Those all have progestin, but doctors will say, I'm giving you a progesterone birth control. The problem is, the other name for Provera is medroxyprogesterone. And in many of the studies, they cut the medroxy prefix off and they call it progesterone. So there is a study that, if you read the whole study, it's about progesterone. It's about Provera, medroxyprogesterone. But if you read the conclusion, which most of us do, we go straight to the conclusion. The conclusion says, therefore, caution should be taken if giving women progesterone because of the increased risk of breast cancer. And you'd be like, oh no, that's terrible. But if you look at the study, they're talking about medroxyprogesterone, which is Provera. They use Provera and progesterone so interchangeably that sometimes when I'm reading something online, I don't know what they're talking about. Progesterone is progestation. It's the hormone you need to carry babies to term. Women need to carry babies to term. Okay, so that's Provera. That's the Provera part of the Women's Health Initiative. It's a progestin. The pregnant horse pee part is Premarin. It's the estrogen part. And they're really, besides the way it's made, is really not a big deal. Okay, you have to keep horses pregnant all the time. And I know a couple people that have rescued Premarin mares and their offspring. But anyway, from farms. There's really not much wrong with Premarin, except it can cause heart attack and stroke. However, based on the Women's Health Initiative, I just told you that the mean age of those women were 60 and above. So you already have clots forming to break off. But statistically speaking, about the clots and the strokes, not humanity. It's only 30 per 10,000. That's not a lot. Okay. That's pretty much your net normal that would happen among that kind of population. But we don't use Premarin and we don't use Provera. If, however, I would have started Premarin, pregnant horse pea estrogen, on my 50th birthday, I would have been fine. Because after the first year, your risk greatly reduces. But after about every year, your risk reduces by about 20%. So after 5 years, you're back down to your net neutral. But nonetheless, we don't use pregnant horse pea and we don't use Provera. But when you go to your provider, they think you do. So ACOG, the American College of Obstetricians and Gynecologists, and NAMS, the North American Menopause Society, say if a woman complains long enough and loud enough, that's my interpretation, give her the lowest amount of hormones for the shortest amount of time, and no woman ever should be on hormones more than 5 years. They're talking about the Women's Health Initiative, which is pregnant horse pea Premarin and medroxyprogesterone Provera. So I had a patient, this has been many years ago, probably 6 years now. She was having some issues with tumors on her kidneys. And when my friend, the endocrinologist, my friend, found out that she was on estrogen, he told her, you've got to get off that. You've been on it for more than 5 years. It's dangerous. You're going to throw a clot or a stroke. He's talking about Premarin, pregnant horse pea. My patient's on estradiol. Okay. So super confusing. And I told you last night about the Mercy doctor that told me he was giving me a progesterone-only birth control. That's not true. But nonetheless, the position statement by those two organizations are based on Premarin and Provera, which if you're in a smart provider's office, they're not going to use that. The other thing with the menopause part is, everyone knows who I believe in. So he made our estrogen receptors in our body to be squares. So when I took my estrogen pill this morning from the compounding pharmacy, my body recognized it. It was probably the easiest thing my body did today. Put it right into the receptor, square receptor, estrogen went right in, lock and key. If you use pregnant horse pea, we do share 2 estrogens with those sweet babies, but they have like 9 or 11 or 13 altogether. So now you've got all these other estrogens that your body's trying to figure out where it goes. It does not fit lock and key, and that's where you can get side effects from. So we don't use Premarin and we don't use Provera, but your provider thinks they're the same thing unless they have extra training. Any input on that?
No, not yet.
Okay.
Are you looking for input from me?
Yeah.
Oh no, you're the one who's smart on this stuff.
Well, so just so you know, all of the studies for hormones have been done on pharmaceutical available bioidenticals. That's S-Trace at CVS, Walgreens, the local pharmacies. S-Trace is bioidentical estradiol. I don't think either one of them are clean. I think they're whatever. But estradiol, S-Trace at the local pharmacy comes in 0.5, 1, and 2. So I told you last night that I'm on 2.75 milligrams of estrogen. You guys could try to do the math all day long. Take your time. It doesn't add up. There's no way for me to do it. I'd have to take the closest I could get as a 2.5 and take both of those pills together. And then Prometrium is the pharmaceutical available bioidentical progesterone. And it's in peanut oil. So those of us eating like this that are trying to stay away from seed oil, it's in peanut oil. They just dropped 1 dose. So now they only have 100 milligrams and 200 milligrams. And a lot of people, sometimes want to save money, and sometimes insurance will pay for those at CVS or Walgreens or whatever. But many times patients notice the difference between commercially available progesterone and estradiol and compounded. You have to find the right compounding pharmacy. The one I use is in Utah. It's called MedQuest. It's PCAB certified, just means they went through the extra paying of third-party testing and quality testing of ingredients. And I've been using them exclusively for so long, and they're also cheaper. We have compounding pharmacies around here, and I use the one in Utah at MedQuest.
Yeah. Last night, I know you mentioned this when you were talking a little bit about progesterone. You talked about the sleep benefit of progesterone and whatnot. The other day, you had a conversation with a doctor colleague of ours, and you were talking progesterone and whatnot. And I had picked up on, you were talking about progesterone and the dosages, and with regards to a pregnant woman versus them taking it orally and exogenously. Yeah. Do you want to mention that a little bit? Because that was really interesting to me.
And so remind me another thing we were talking about with Dr. LaFerrier about medical journals. But when you're pregnant, your progesterone levels should get into the 300s. you would have to take progesterone every hour on the hour all day long to get that level, and you would be zonked out and you wouldn't be able to swallow a pill. So still, if you tell your GYN or your primaries, like what I told you my dose is, they'll get excited because they don't understand it. But when you're pregnant, there is, for every week gestation, there's a level of progesterone needed to sustain that pregnancy. I'm not saying pregnancies don't end because something's wrong with the baby, which is unfortunate. But most pregnancies end in miscarriage because of progesterone levels.
Yeah.
And now in today's day and age, we do not have enough hormone levels. We have an infertility issue. We have insulin issues and all that other stuff. But what I was going to say is when we were talking with Dr. LaFerrier, he said, because he works out of my office, and he said, I just get so annoyed and perplexed when women go off their hormones because their primary said it's going to cause breast cancer. He's like, it makes me so angry. And I get it. But he even said he still reads JAMA, the Journal of American Medical Association. I wouldn't, but he still reads it. But he says all the time there are still articles in there about hormones being dangerous. And so that's what your provider's reading. This is what endocrinologists are reading about thyroid medicine, which we'll do a whole video on thyroid. They're just misinformed. And one time I shared earlier this year, there's a doctor that wanted to know kind of why suicide rates were so high in physicians. And she said, on average, in an insurance model, I shared this on Facebook, your provider is seeing 28 patients a day. After the 9th patient, your doctor, doesn't matter if it's male or female, is done. After the 9th patient, they're done. Now you got 20 more patients, 19 more patients to see, and you got to have everything just right. I mean, and then you go home to a family and all the things that we do and young families, and you're going to get on the computer and learn more things like.
Yep. And in that insurance model, remember, only 15 minutes goes to you. So, they see 4 patients in an hour. They've got 5 minutes to spend with the patient, 5 minutes to write and order prescriptions, and then 5 minutes to chart.
And now their back is to you because they have EMRs in the office.
Yeah.
When I did work primary care, I never got my charting done. I always had to come in early the next time I worked to do my charting because it just wasn't enough time.
Yeah. When I remember I went to the VA one time and I saw a PA, and the PA, I don't think he ever made eye contact with me during the visit. I walked in and I sat down and he was typing for about 5 minutes before he even said the first word to me. And I was literally just was like, am I in the right place? Or am I supposed to be? It was just bizarre. But anyway.
Well, and tomorrow we'll do part 3 of this and we'll talk about breast cancer, why I think there's more breast cancer than there should be. But hormones do not cause breast cancer. And the book you need to get, I should have brought it over, is Estrogen Matters by Dr. Avram Blooming. He is an oncologist whose wife had breast cancer. So, and then his daughter had breast cancer and then got treated and went on to have babies and stuff. Number one, if we think estrogen causes breast cancer, I had babies old from maternity. I had babies at age 36. My estrogen is the highest in young adulthood and puberty and highest at pregnancy. I would have died before I could even procreate. All of you guys would have. There are lots of studies. There's a meta-analysis, and I think it was 21 studies that show breast cancer survivors. One group went back on hormones. The other group did not. And there was no increased recurrence of breast cancer between the group that took hormones or the group that didn't. In fact, women, when they get diagnosed with breast cancer, if they're already on hormones, they have a better outcome. So I just got a text from a patient today that I've been seeing a long time. Her mom lives in Oklahoma and has breast cancer. I just put her on estrogen. She's been on the other hormones with me for a while. And she messaged and said, my mom's doctor said he'll lose his license if he gives her hormones because she has breast cancer. Is this true? And I said, he's using that as a cop-out. No one's going to take his license because there's tons of studies that show, but he needs to read the book Estrogen Matters. And, it is hard though. I have quite a few women on hormones after breast cancer. It is hard because there is a recurrence risk of cancer, no matter what cancer you have after 5 years of getting it again. So the patient has to be confident that they could get breast cancer or cancer without being on hormones. So yesterday I saw a patient who's fairly new to me. I've probably been seeing her for about 2 years. She was kind of sullen looking. And so I said, how are you? And she said, fine. And I was like, I feel like that's fake. And she said, well, my mom has breast cancer and she's going through treatment. And my mother-in-law has breast cancer and she's going through treatment. So I say to her, are they on hormones? And she says, no. So you can get cancer on hormones. You can certainly get cancer off hormones. Most women that get cancer are postmenopausal women. Now, occasionally, and I have 2 right now, I get breast cancer in my patient population, but I have 700 patients. So there's going to be at some point something that pops up. So anyway, I feel like that's about it. The Women's Health Initiative. Oh, the other thing is every scientist or groups that have pulled the Women's Health Initiative data and look at it, they never come up with the sensational headline that they released in 2002 that hormones cause breast cancer. It's so statistically insignificant, but you can do absolute risk reduction and relative risk reduction, and you can make a 2-point increase look like 100% or a half. And so they've never been able to reproduce it. And so many studies show hormones are protective.
Nice. Right on. How are we doing?
I think that's it.
Okay. I'll just pipe in and say a couple of things I wanted to get off my chest really quick here. So as always, guys, thanks so much for subscribing and whatnot to our channel. Last week, I think it was, I made mention that we had hit like 900 subscribers and we were like, woohoo, we're so excited. Well, last night we hit over 1,000. So like, we're starting to grow exponentially. I just wanted to just a big shout out to all you guys out there that have subscribed and liked our pages. We love you guys and we're so appreciative of that. So make sure if you haven't already, please like or subscribe to our pages, and then throw any comments you have our way, any kind of little stars or thumbs up. All that stuff helps us tremendously. Yeah. So we're very appreciative.
I do remember what I was going to say. Okay. I had a piece of paper. I left it at the office, but 2 people today, actually 3, but 2 people I was going to talk about. One is a woman. I can't remember how old she is, but she's been with me about 5 or 6 months, still not doing as great as I would want her to. But she went to her regular doctor and he said to her, and I just cannot believe that we pay people to treat us like this, because the way I treat people in the grocery store is better than this. But he told her, well, it's definitely not hormones because you're on hormones now. Well, I got news for you, buddy. Her estrogen and her thyroid are not optimized yet. But he said to her, there's no shame when your brain fails you. Gulp. So now she's walking around with this because she's struggling with mental stuff. She's struggling with that. And so I just stopped her and I say, what you guys know that I think, we are under spiritual attack. We are in spiritual warfare right now. So I said, that is straight from the enemy because he is not omnipotent, but we say what he needs to know. You walk around calling yourself stupid and dumb and fat. You can't get it together. And, so he knows what to say. So then he co-opted this seemingly normal person to do his bidding. I said, this is not nice, but doctors, many of them are morons. You don't say that. You don't speak that over someone's life. You speak life over them. Okay. Yeah. And then my last patient, she's been seeing me for about a year. She's lost 100 pounds, got in a fight with her endocrinologist because the endocrinologist wanted her to go plant-based, eat quinoa and fruits and vegetables. She says, now I eat a ribeye every single day. She did my labs at the endocrinology office, but her thyroid came back and I look at it and I see the TSH that my dose is probably good, but her T3 looks pretty terrible. So I say, when were these labs done? She tells me 7. So I say, oh, you must have skipped your thyroid. And she said, yeah. And I'm like, that's why it looks terrible, but you feel great. And she said, the endo told me it was totally fine. And I was like, of course they did. But I'll have to bring that paper home because the stuff that endocrinologist told her, this is a female endocrinologist, told her is mouth dropping, jaw dropping.
Yeah.
Bad.
Yeah. All right. So, well, we're going to go ahead and wrap it up here. We're getting almost 20 minutes. So thanks for watching so much, guys. And again, we love you all. Yes. And we'll see you next time. God bless you. Bye-bye.